Herbalism refers to folk and traditional medicine practice. It is based on the use of plants and plant extracts. It is commonly known today as phytotherapy. Many of the pharmaceutical companies currently available to Western physicians have a long history of using herbal remedies. It includes opium and aspirin, and many more. The traditional system of medicine includes herbal medicine as their base and have been used for many centuries for healthcare by people in countries mostly in Southeast Asia, Africa, Latin America, and many other parts of the world. Ayurveda, Siddha, Unani are a system of traditional medicine native to India. Ayu means life, Veda means knowledge. This system is called the science of life and longevity. Ayurveda means not only treatment, but it's a way of life. It was first coined during the Vedic period in India. It is used to maintain health in healthy people and cure the sick in sick people. It focuses on the body and its illness, and it does this by rejuvenating the body through diet and nutrition. Over the years, Ayurvedic medicine has been used by practitioners in various treatments in form of alternative medicine. It is used in procedures, it is used in their pills, and it is used, and because they see it as a way of life, it's commonly known in India.
Next, we're going to talk about Ayurvedic treatments. The goal of Ayurvedic therapy is to return equilibrium to the three doshas, all of which are associated with a certain element. The three doshas are Vata, Pitta, and Kapha. Vata, wind, is associated with the body's movement. Pitta, fire, controls the body's metabolic system. And Kapha, water, is a glue that holds all of the body's structure together. These three doshas flow constantly throughout the body in unison, and similar to traditional Chinese medicine with qi, when one of those is blocked or hindered, that is when sickness and disease occurs. For this type of treatment, the primary aim is to promote good health and not to fight signs and symptoms of disease, or the disease itself. Aligning with the belief of constant flow, most Ayurvedic medications are taken in liquid form, such as teas. It ensures smooth functionality of the body and is preferred over solid medications as it can interrupt the flow of the three doshas. So medications that come in pill or tablet form might be refused by patients practicing Ayurvedic therapy due to concern for it blocking the stomach, which is governed by Pitta. Some herbs used in Ayurvedic therapy include Triphala, Boswellia, and Guggul. Triphala is said to exert antioxidant effects that neutralize free radicals and prevent damage to the body. Through this, it is believed to prevent or delay age-related diseases such as cardiovascular disease and cancer. Triphala has also been known to be used for the treatment of obesity, diabetes, and hypertension. Boswellia is taken for its anti-inflammatory effects similar to NSAIDs and corticosteroids. It's used to treat chronic inflammatory conditions such as asthma and arthritis, and has also been used for its potent analgesic effects. Guggul has been used traditionally to treat hyperlipidemia. It's important to know that while these herbs may claim to have a specific effect, a physician should be contacted before taking any of them, as it could have some sort of interaction with currently prescribed meds.
It's important to recognize the advantages and disadvantages of herbal medicine. Some advantages include that in most cases, herbs are more affordable than conventional medicine. They are easier to obtain than prescription medications. They promote natural healing, and they are known to have significantly fewer side effects. Integration of Ayurvedic and other Indian traditional medicine in clinical practice will be helpful in promoting the health of people who are unable to access modern medicine properly. For example, people with no insurance or people who can't afford prescription drugs or treatments, because we all know some of those prices can be out of this world. Generally, herbs are cheaper than most prescriptions. Some herbal medications don't even require prescriptions, and herbs are derived from plants or are plants. So with the correct preparation and administration, these could be curated on your own. Some products of Ayurveda have been successfully evaluated in clinical trials for the treatment of bronchial asthma, rheumatoid arthritis, ischemic heart disease, and cancer. Ayurveda is gaining momentum as a successful alternative to conventional medicine through its systematic strategy of curing and preventing disease through using natural remedies. This is a good place to bring up that herbalism is a form of alternative medicine and is more focused on the holistic view of the patient, which is more about treating the patient spiritually, physically, emotionally, all those different aspects, rather than just treating the disease as conventional medicine does. There are disadvantages to herbal medications, and one of the biggest disadvantages is lack of research. Others include adverse reactions and food interactions, and misuse and misidentification toxicities. The lack of research is the major disadvantage. This is due to the high cost and amount of time taken for that process, which includes multiple trials, adequate knowledge about herbalism, high-quality clinical trials, and proper information about herbs and their effectiveness are required in order to promote herbalism. Several herbal products can interact with food, allopathic drugs, and pharmaceuticals, and it is important to recognize this when you are taking drugs from conventional medications, or if you are starting a new herbal remedy and need to take acetaminophen or something similar to that. Being aware of adverse and food reactions is important. Several herbs may be responsible for serious adverse effects. For example, creosote bush causes hepatotoxicity. Ephedra may be responsible for cardiovascular complications and hepatotoxicity, and kava may induce hepatotoxicity. Another huge disadvantage to herbal medication is the misuse and misidentification of the plants and herbs. Education is super important, and people must know how to correctly prepare and administer these herbs and herbal remedies. So some herbal meds use the whole plant, some just use the root or the stem or the leaf or any kind of that mixture. And if you use the incorrect part of the plant, if the incorrect part of the plant is used, toxicity can occur. And if you do use the incorrect part of the plant, you won't get the desired outcome. So it's really important for education and research of herbal medication to be furthered.
There are several things to consider when one starts taking herbal medication. The first thing is that many people believe that herbal medicines do not have side effects. This is not true. Herbal medications have many interactions with drugs, with food, and they can also cause allergic reactions. So it's very important to consult with a physician before you start taking these herbal medications. If you notice that you have hives, itching, or if your throat feels tight, it's important to consult your physician right away. Additionally, it's important to follow recommended dosing to avoid these possible side effects. It's also important to consult your doctor if you're pregnant and taking herbal medications. There have been several studies that indicate that herbal medications have teratogenic effects. In a systemic study on zebrafish and herbal medications, it was shown that herbal medications led to spinal defects, cardiac effects, and many other things. Lastly, herbal medications have been linked to kidney damage. If you're an older individual or have a pre-existing condition that affects your kidneys, it's very important that you consult with your doctor before taking herbal medications.
Cultural competency framework emphasizes the patient and their culture. Safety and security for this patient and the clinician is number one goal. It is important that when traditional opportunities are presented to the healthcare providers, they aren't looked over. Understanding and respecting the values of different medication in other culture is important. The goal is to understand what Indian traditional practice is being utilized to prevent any misunderstanding of medication interactions and treatments being given to this patient in the allopathic practice.
As healthcare providers, we must plan for intervention. Healthcare providers must be culturally aware and respectful when treating patients who practice herbalism. Herbal medicine may be used along with traditional Western medicines. A combination of herbs and prescribed drugs can have adverse effects. Some examples of this are St. John's worts and antidepressants with serotonin could cause serotonin syndrome, which causes the serotonin in your body to rise too much, which can lead to seizures and muscle rigidity in patients. Turmeric should not be taken if patients are on warfarin, aspirin, or any other blood thinners, as well as chemotherapy drugs due to the turmeric inhibiting it to be metabolized and used in the bodies. As healthcare providers, we should ask patients what medicines they are taking, which should include prescription medications, herbs, and any other herbal remedies they may use. As healthcare providers, it should be a safe space for patients to speak to professionals for medical care that works best for them.
To determine the effectiveness of the herbal treatment regimen, follow-up surveys and checkups will be of most use. Checkups at set amount of times after the treatments were prescribed will be carried out. Through surveys and checkup questions, the effectiveness of the treatment regimen can be determined. Questions about the success of the herbal remedies will be asked. These questions will include adherence to the treatment regimen, success in the usage of the treatment regimen, and personal thoughts and feelings regarding the prescribed treatment. This data, along with other demographical data including gender, age, socioeconomic status, and diagnosis, will be used to cross-reference the effectiveness of each prescribed herbal remedy or each personal used herbal remedy. This method will help narrow down the effective herbal remedies used to treat illnesses and will help doctors more effectively prescribe herbal remedies to their patients. It will also weed out any herbal remedies that may not be helpful at all or that may even be dangerous. Through the collection of data, allergies and drug interactions can even be noted in regards to specific herbs. This evaluation can also be completed on patients who may not have been prescribed the herbal remedies, but that take them personally. Although this method may take a while to accumulate definitive data, it will be the most definitive way in determining the effectiveness of each herbal remedy. Continued evaluation of checkups and surveys can help researchers determine which herbal remedies can be of most use in the medical field.